Excuse me, ladies and gentlemen. Thank you for your patience in holding. We now have your presenters in conference. Please be aware each of your lines is in a listen-only mode. You may submit your questions electronically anytime using the chat pod located to the right of your webinar platform. You may also download a copy of today's slides using the Files pod located directly below the slide presentation. It is now my pleasure to turn the conference over to today's first presenter, Chris Hund. Please go ahead.
Thanks, Stephanie. Hi, everybody. This is Chris Hund, Senior Director with the American Hospital Association Center for Health Innovation. Great to have you all today. It's a huge group joining. I love that. I love seeing where you're all from. So thank you all from really a worldwide audience today for joining us for the September NHA Team Training webinar on psychological safety and building team strength in crisis. So thank you all very much for joining. And a special thank you to the Ohio State University College of Nursing, who is helping to sponsor this webinar this month. So thank you to them. All right, some rules of engagement. So the audio for this webinar can be accessed in two separate ways. You can do it through the phone, which is the way that I actually like to do it. And if you do that, you're going to want to mute your computer speakers. This way you don't get weird feedback. If you don't want to use your phone, you can do it through your computer. So that's another way to do it as well. If you run into some sort of issues hearing and you're doing it through your computer, just give a try through the phone line. That might work better. That phone line is in the notes pod that you see on your screen right now. All hyperlinks on the screen are active. If you click on them, and we'll open another window, so that's great for you. We'll have a Q&A session at the end of the presentation. That's the way that we like to do things, especially with a giant crowd like this. So what we're going to ask you to do is to chat your questions in as you think of them. And as those questions pop in the chat box, we'll grab them and try to make some sort of organized Q&A with our speaker at the end. If your question is more of a logistical nature, if you're having some sort of issue technologically, we'll answer right away for you. So that's how we're going to go about Q&A today. Continuing education credit is being offered for this webinar. You can receive one continuing education credit hour, and to do that, you're going to create a Duke OneLink account. You might have already done this if you've been on past webinars, so you only have to do it once. You can use it for all future webinars too if you've done it. Instructions on how to do this can be found in the Files pod that you see on your screen. Also, what you're going to do, just to let you know, is that you're going to register for the account. You're going to activate your account and confirm your mobile number. And then after the webinar ends today, you can text the code that's on your screen to the phone number that's on your screen, and you have to do it within 24 hours. And that's the way you get CE credit. So if you have any sort of issues with that, just let us know. But pretty straightforward, and we'd love to be able to provide that credit to you. Some upcoming events just to let you know about. So we have our first online course that we're offering. So this is TeamSTEPPS for Change Leaders and Champions. So this is going to be over a 7-week period. And what we do in this course is we introduce you to the TeamSTEPPS framework and the tools of TeamSTEPPS. And we're going to talk a lot about how to effectively manage change, build team resilience, and really integrate teamwork practices into your workflow and the initiatives you already have. What's going to make this special, and I think pretty effective actually, is that you're going to learn about a tool, we'll talk about it, and then you'll have a week to go back and try those tools out. So we'll be able to do a lot of small tests of change, and you'll come back next week and say, this is what worked, this is what didn't work. And so we'll be able to really get that nice cycle going. And I feel like this will be a very interesting way of trying to get something implemented. So register today. We actually are selling out of this already. There's limited spaces left, so if you're interested, jump on in there and register. We also have a webinar coming up, and that webinar is on October 14th. That's on obstetrics team-based approaches and how they improve value. We also have our online community platform that we're very happy to see growing, and that there's a lot of great communication on and conversation. And that platform is called Mighty Network, and if you sign up for it, it's free, and you get exclusive content, and you can connect with your peers, and there's people sharing tools, a lot of storytelling and content, and so I think that that's a really great option. Okay, we are just wanting to thank the Ohio State University College of Nursing for sponsoring this. I'm going to move through these slides. Our representative is just having some difficulties joining. You know, all the fun with tech right around these days, right? So I'm just going to move through this. And then I wanted to introduce our speaker. And so our speaker today is Sanne Holbrook Henninger, and she is the Patient Experience Director at Duke Private Diagnostic Clinic. So we're really excited to have her today. She has a lot of great information to share. So without further ado, I'm going to toss it over to her, and we will have a conversation at the end. So, Sanne, off to you.
Wonderful. Thank you, Chris. All right. Well, hello, everyone. So I'll reintroduce my name because it's pronounced unusually. It is Sanne, rhymes with banana. Glad to be with you guys today. I appreciate you taking the time and hope that everybody's well during this really challenging time. And that was the background for my interest in putting this together in the first place. So today we're going to really look at some skills in building or strengthening a team. So I know many of you are really skilled in working with teams, but I wanted to provide a whole host of best practices for working with teams in any stage that they may be in. So we'll get started. And so this is our model. This is our quality and safety patient experience model, and you will see that within those circles there at the top, it is resting in the quality and safety culture. So it all starts with culture, really any patient experience outcome that we are looking for, as most of you would probably agree and work from that concept. So difficult times. I really have been working so much with teams over the past many years, and in the past 5 or 6 months, there certainly was an increase in requests for me to work with teams where there had been some kind of team disruption, whether it was stress or conflict between employees. And I decided that I wanted to put something together that was proactive and that included a lot of what I end up doing with teams anyway. And so wanted to provide that for you guys and hope that it is helpful. Would love to be able to see you and talk with you about your teams. I'm looking at all the places that you're from, and it's so exciting. So we know certainly that high stress in teams is a part of the safety culture that we have to keep an eye on. And it has such a systemic effect. We know that physicians and clinical staff relations are predictor of clinical outcomes, and difficulty speaking up is predictor of clinical outcomes as well. We know that when we're stressed, we're not as smart. We don't use as good judgment, and it's a source of conflict as well. So systemically, we really have to watch our stress levels, measure them, and certainly address them as well. So looking at one of the first steps, and I put this section in a little bit later than the first draft that I put together. This first section here is a couple slides I'll actually roll through pretty quickly, but when I'm working with leaders and when I'm working with teams, what I often find is that they really want to jump into some ideas, some activities, some education for their teams. And I realized that at times people have not really sat back and said, what are the actual problems? So right in line with mental health or medicine. So my background is mental health. I was a therapist for 22 years. So whether it's mental health or medicine or performance improvement, all of the first steps have to do, of course, with analysis before doing an intervention. So I just sort of took the A3 methodology here and made a variation on it. So whichever that you use, whether it's DMAIC or, again, another form of evaluation, really encourage teams and team leaders to take the time to evaluate that team. So always think about what are you actually looking for when you're evaluating your team. So what you would be evaluating, of course, is on those domains of what a healthy team is. And so I collapsed several different domains together, this from the culture pulse types of questions, from the different types of culture questions that you may have implemented in your surveys, perhaps in your institutions, and just tried to collapse it together into the most common domains that support a healthy team. And this would be certainly the areas that you would first evaluate your teams. So when we talk about psychological safety and tying that with teamwork in healthcare, we want to know what we're looking for as well. So a safe environment, using those domains on the previous slide, really you've got a leadership that shows a united front, and there's no question about that. Communication is well structured, roles are clear, and then an unsafe environment certainly would be when there's lots of conflict, when behaviors are allowed that shouldn't be, when there's blame as opposed to discussion around processes and mistakes. So we know that's what it looks like. So then you have to think about what questions do we need to sit down and ask ourselves. So as you look at those domains, the first place, of course, is for leaders to really sit down and ask the right questions around the domains that are most critical to an effective team. And so I've put some examples here. This slide deck is full of lots and lots of materials, and it's materials that you could certainly read afterwards. So some of it I won't read bullet point by bullet point. So then in that first step of evaluation, it's really also a time to think about how do we want to get some more information about our team. So certainly, again, leaders sitting down and going through some of those critical questions and those critical domains of where is my team and what's happening. And there, you may find some underlying issues that you were either not aware of or paying attention to because, again, stress, human systems are all very systemic and very interrelated, and you want to catch all of those small pieces and know which one is impacting another. So leadership teams getting together and looking through those questions, and then rounding on employees. So as you get closer to having an understanding of what you think are some of the target areas for your team, then you'll want to round on your employees, perhaps picking one or two questions that you really want to know a little bit more about, and meet with several or all, depending on the sizes of the groups that we're considering, try sort of interviewing them to find deeper answers to some of those questions. I also have lots of teams that will do small online surveys, so they'll just create 3 to 5 questions perhaps and get answers to those questions from their team to do that evaluation. And then we can think about a case study. This is a very small case study, and I'll just kind of read it off. But let's say you had a very high-volume clinic or hospital area that is struggling with low team morale. So the manager and medical director may be serving other areas, often off-site. There's a new nurse manager, COVID stressors, lots of change, and now we have 2 conflicts that happened recently. That is a story. And by story, I mean when I am listening to leaders talking about the problems in their clinics, it comes out as a story. And often as you're talking with each other, perhaps as leaders, it may be a story. And you want to break that down into something that is a little bit more user-friendly for yourself. And so you're making that problem list, very similar to what I showed you before on the A3. You're now just listing it. You're taking a story, you're putting it into a list form. This is not difficult, obviously, for you to understand, but it is a simple way of capturing what is happening with my team and then what are my next steps. So there it is listed in 5 different sections, and then you will begin to ask yourself the right questions about those 5 different areas and sections that you have identified. and then you can put it into some kind of graph form where you're a little bit more organized. So after you've done rounding, you've collected the cause and the impact, and then you can actually establish some goals. And at the very end of this presentation today, I'll show you sort of what some of those steps might be. But in thinking about this team or in thinking about your own team, as I go through several best practices in the next 30 minutes, be listening for ones that really make most sense for you and for your team and for this team as well. So tools for building strength in teams. There are so many. And this could have been a 5-day, 3-month, year-long class. And so I really worked hard to collapse it into some of the best practices that are related to things that we know about teams and safety and stress. So certainly evidence-based, but I didn't take the time or want to go through all the research behind them. Certainly can provide you anything that you would like related to that. So starting with leadership and leadership foundations, the first one really for any team and any team development is the alignment of the leaders on goals, on perspectives, on philosophies, on how to manage conflict, on how to deal with difficult situations between employees, really making sure that there is alignment on all of those, but even alignment on more simple things like how are we going to communicate. You know, I've worked with leaders where one leader is an email bullet point kind of person and the other one is sort of a storyteller, and really needing to come together even just on how we're going to communicate with one another. So this is a simple set of questions here. I've used this with executive teams. I've used this with clinic leaders in a clinical area. So I just encourage you to take a look at some of those questions, sit down with your leaders, and really ask the big question: Are we aligned, and do we appear as a united front? So psychological safety. This is a part of teamwork to evaluate in a couple of different ways. So psychological safety, we know, means that we are not afraid. So there is minimal anxiety. And the fear that we could feel at work are the same fears that we could feel in the rest of our life. So we may have physical fears, and actually in our healthcare environments today, we are actually feeling fears with COVID. And then we have other kinds of fears that can emerge as well, and that is around acceptance, autonomy, a feeling of certainty and control and protection and safety, and of course being appreciated and competent. So this all comes from Maslow's hierarchy of needs. I'm sure many of you recognize that. I thought it was just such a great, easy way to remind us of what the anxieties are and how we might actually focus on them individually and directly. So one simple activity, you'll see on many of these slides that it says the word activity. The idea is, as you round on your employees as a way of showing support or of trying to evaluate where individuals are or where the group is, you could really almost evaluate based on those particular psychological safety domains. And so I just listed them here. And again, this is just a way you could kind of go through and think about, are they feeling appreciated? Are they feeling competent or, uncertain with so much change? Do they feel accepted? Are they able to kind of work on their own, or do they need additional help? So they really poses some questions that you could think about as you round on individual employees and looking for areas of improvement for your teams. So this is another slide. Again, I'm not going to read it bullet point by bullet point, but it is stress management for psychological safety. So a part of being a leader will be not counseling people, but certainly helping them and helping your teams to think about their stressors and how they may think about their stress management strategies a little bit differently so that they can feel the best they certainly can at work. And I do have a section also on how to help teams support one another, so that is coming up as well. Building psychological safety in your team. So if we are thinking now about psychological safety from the standpoint of, I am comfortable asking a question that may show that I am not as competent as I would like to look, or I am comfortable sharing a mistake that I made, or I'm not afraid to speak to anybody in this clinic that, there won't be a bad mood coming back at me. that is the psychological safety that we're certainly looking at day to day in the interactions with our employees in the healthcare workplace. So there are a couple to think about. One is the amount of change that is happening right now is stressful in itself. So the simple practice of every time a change has been presented is just simply saying, what concerns do you have immediately afterwards? Another psychological safety tip is to have learning meetings, and I've encouraged learning meetings both in briefs and debriefs or just separate on their own. But a learning meeting might be similar to what many of you may have done at some point, is sort of a mistake meeting, where it is actually encouraged to talk about what was confusing this week, what change happened that I misunderstood, where were our roles not clear and we got confused. A learning meeting, you could even name it a learning meeting and encourage people to talk about, again, what was confusing, were we unclear with our communication perhaps. That is encouraging the safety of really talking about anything, to include even conflict. So there's a couple of examples I will show you about that as well. So here's some activities. Again, some of these slides are meant for you to take with you, make them as handouts, give to a committee lead perhaps if you have committees in your clinics or hospital areas. So updates burnout, so that was one request we got here at Duke. How do we manage updates burnout? So perhaps even adding, as you've given a COVID update, perhaps adding a more positive update, maybe even about an employee in the room or something in the news that's actually positive. Remembering that minimizing anxiety comes with acknowledging it first and helping people to acknowledge it first. And then the second piece is support, and the third piece that the brain really needs when it is not feeling in control or has a lot of anxiety is it needs some kind of plan. So talking about plans and data and next steps is really helpful to your staff. And we talked about the making mistakes kinds of meetings. This is just another resource, and this is almost a reminder that there are so many wonderful resources out there. I really like to narrow down resources, and that's why I'm hoping this slide deck will just be sort of one best practice resource for you. This is another one. It says it's sort of a manual of different ideas that you could use with your team. So managing change, another part of teamwork is helping your teams manage change and really think about it with a good perspective. So human brains do not like change at all. We are designed to have a protocol, to have a status quo, to go into automatic pilot and feel comfortable there. Often when we're even encouraged to do a positive change, we may not want to do it because our brains are saying, no, I'm not doing that. So there are two questions that the brain is going to ask, and then a third one ties right in. And the first one is, why should I do this? So even if you, again, are encouraged to change a habit because it's good for you, your brain may say, I really don't want to. So you want to appeal to people's buy-in as much as possible. Now, many change happens that we have no control over, and the buy-in is really trying to get ourselves to a point of acceptance in some manner. Can I do this is the anxiety, and then do I have some control here? So once again, as we are anxious and as we go through change, there are certain things the brain is really calling out for, and one of them is control or a plan of some kind. Also remembering that both teams and individuals will go through stages of grief with any kind of change, even positive change. And the stages of grief don't all necessarily have to be bad, but you are moving through stages at many layers all the time, and helping both individuals and teams to almost see where they are on that scale of change can be really helpful. And I think if we even think of healthcare right now, initially there was a lot of shock, denial, and just a lot of fears around COVID and managing. And now I think we are moving our way towards acceptance and have come such a long way. But I think understanding where you are on the scale of change can be really important. Now, this is one of the most important activities, I think, probably in this slide deck, and it looks very simple, but very powerful. So whether or not you're thinking about change with your team, your own level of stress, it is always important to delineate what can you control and what can you not control. And often we just don't do that. And sometimes our teams don't do that. And they will continue to ask about things that maybe we just know we can't control. So I think it's important for individuals, for leaders, for people who are stressed, for teams going through a lot of change, to really clearly hear and see and discuss the things we can control, and let's do it. And here are the things that we cannot control. How can we best manage that? So again, whether or not you're thinking about your own personal stressor or a team is really going through a lot of change, this is a very simple activity that can help teams move forward. Again, moving your teams forward through stages, also sharing with them how they are moving through those stages. So some team strengtheners that can pull people together. So this section is more about communication and fostering an environment where people are psychologically safe and comfortable in communicating with one another. This is an activity that I actually made up just driving to a clinic one day where I was going to be working with a large number of professions and employees. And it is basically 3 questions that you ask each profession. So often I put the providers in one side of the room, the office staff in another side of the room, clinical staff, if possible. Sometimes meetings are difficult, but the idea is that each of them answer the same 3 questions. So one is, what do we predict they need from us? What could we do better? And then what do we need from them? And then what do we appreciate? So those 3 questions, each profession answers towards the other. So sometimes providers will say, well, but, the clinical staff probably need us to be a little more consistent. What we need from them is to room our patients early in the morning, and what we appreciate in them as a group is that they, help us through our day. When each profession answers that, you will end up with 3 to 5 actionable items per profession. And again, you could do this with 3 people. I've done it with groups as big as 350. But you will end up with just 3 to 5 collapsed themes that will be actionable for each of those professions. It also allows each profession to really hear the stressors and the struggles of other professions. Handoffs. So this is a slide really to remind people and employees to evaluate their handoffs. So when and where does communication tend to fall through the cracks? Where would cross-training of some kind perhaps be helpful? And I really call it cross-understanding. So sometimes clinical staff and providers and office staff don't understand each other's workload and then are frustrated with one another. So maybe a sort of cross-understanding. What kind of processes or standards or checklists need to be in place? So for those of you who know and love TeamSTEPPS, then you will know how powerful checklists can be. So again, just a reminder to ask the question and have your teams ask the question, where do we not close the loop perhaps? And these are the 2 activities I mentioned just now, cross-understanding. So here's what's hard for us, right? Give that to each profession to answer, and then each of them can share what their life is like and why sometimes the interaction between 2 professions may be more difficult than would be expected. So SBAR, most of you know SBAR. I am a believer in SBAR. It's very, very simple. I have seen it used in some really complex ways. I've had providers and triage nurses, frustrated with each other. The triage nurses felt like the providers were not consistent in what they needed. The providers felt like the triage nurses were not thorough, perhaps. And so I pulled them together, and they created an SBAR template that everybody looked at and used, and then suddenly the communication was much better and more clear. I know another provider who uses SBAR now to dictate his notes because that kept him more organized, and he felt like that really helped him a lot. So here's a handout that you could use with your professions in terms of perhaps creating a template. So briefs, very, very much a believer in briefs. So brief is basically that short meeting before the day, perhaps, or in the middle of the day. So I have prescribed this for providers and clinical staff who work together who perhaps get behind during the day. Often they'll tell me, well, we communicate all day long. but things are falling through the cracks for the two of them, or one or both of them are actually frustrated. So the brief, as long as you commit to keeping it to 3 to 5 minutes, as soon as it goes over 5 minutes, people drop it. So keep it to 3 to 5 minutes and have a timer and a standard agenda that makes sense for that pair or that group of clinical staff, whoever it is that is brief, that it makes sense for that particular group. So super fan of briefs being a solution to many communication problems. And debriefs. Love debriefs. They are about the following up after an event. So it could be after a difficult event during the week. It could be at the end of every day. It could be an event that is scheduled on Thursdays at noon to discuss what was confusing this week, right, and having a learning moment meeting. Good catches, certainly that's important in quality and safety. So the debriefs, just as powerful. They can be formal or informal, regularly scheduled or not. And perhaps you could use a debrief template between a provider and clinical staff. So at the end of the day, they use those questions that I showed you for the larger groups. Simply, here's what I really need of you, here's what I could have done better, and here's how I appreciate you. Very, very simple tools. So call-outs, also so important in healthcare. So, and a part of psychological safety is how do we call something out to somebody that maybe we're uncomfortable with? And we really want to have conversations about that and what kinds of words can be used to make that the most comfortable that each of us would recognize. And how do we sort of set non-negotiables or team values around how we respond to one another? So training and coaching on good first approach sentences is critical and helpful. And then also, how do we respond to one another? This is a slide that I have used, my entire career, particularly with clinical staff, in not only in first approach sentences, but in the act of task assistance. So again, you'll recognize these terms, of course, from TeamSTEPPS. But how do we work with our teams to be helpful to one another, and how do we make sure that they're on the same philosophy? So I've worked with clinical staff for years and years, and as I interview them individually at times, I will realize that there are two philosophies. One is I shouldn't have to ask for help because if we're situationally aware, people should see when I need help. But then others will say, well, no, we need to ask for help when we need help. And, of course, the second one is really the most true. But what I find is if clinical staff members are struggling with helpfulness and task assistance, it's really important that that group talk about it and talk about those philosophies and really come up to some agreements for how that actually would work. And so you can see on the blue box here, those are actually responses that I came up with as I worked with clinical staff members and teams on how do we actually make this happen. So the last section is on really how do we now coach our teams to be the best that they can be, and how do we use that coaching to prevent team disruption and team stressors. So I really like the emotional intelligence model for leaders to sort of think about how they will coach somebody or perhaps even self-improvement themselves. The emotional intelligence model, if you've not seen this before, is, again, that self-awareness. Am I even aware of when I'm stressed? And if I am aware of it, do I manage it well? Or if I'm not aware of it, then I'm probably not managing it well. And then, of course, the awareness of others. Do I do a good job being insightful around where somebody is and how they're feeling, or am I not very good at that? And then fourth, of course, is do I have the right kinds of words and skills to manage those relationships? So that 4-part box is a wonderful way to self-evaluate, but it's also another way to help others evaluate their own behavior and behaviors with their team members. I really like the assertiveness model, too. So if you're coaching somebody for their behavior, whether it's a provider or clinical staff or office staff, is to think about the fight or flight model. So when we're stressed, we go into fight or flight, and that's either I'm going to fight and be a little bit aggressive, or I'm going to flight and I'm kind of out of here and maybe I just won't talk to you. But the assertiveness is where we want to be and where we want all of us to be, is I'm going to express my needs, I'm going to ask the questions I need to ask, but I'm not going to do it in a way that's harmful to you, and I'm not going to do it in a way that's minimizing and harmful to myself. So again, just another simple model. So if you're sort of trying to think about how do I talk to somebody about behaviors and preventing themselves from reacting poorly, that would be one of them. And here's a simple handout that you could use with either a group or with an individual to think about, here's what a passive response would be, here's an aggressive one, and here's what I really want to say. You may also be coaching your employees for self-management. Maybe they're very aware, again, that they're stressed, but they need some help in actually managing that. And so I actually put this together for someone I was working with several months ago, and decided that's a perfect slide, is, helping people create their own debriefing moments, recognizing their triggers before they may respond poorly, have a routine that they go do before they respond to somebody. So just a couple of highlights from this slide, but if you're looking to think about how do I coach somebody for either self-awareness or self-management, there might be some tips and information that would be helpful for you here. And encouraging personal reflection moments. So we have several clinics who have done such a great job in having a moment in our huddles where they may say, were there any unprofessional behaviors this week, which is an opportunity for people to safely say something about perhaps an unprofessional moment. I really like the opposite as well, where we encourage people to reflect upon themselves. So it's just a moment, does anybody have a personal reflection moment? And somebody could say, gosh, I was really stressed out. I am so sorry that I didn't respond well to you, Jill or John, last week. So it's just a nice way to get in the habit of people really self-reflecting and actually saying it out loud so that others can hear it, and maybe that's making somebody else feel better as well. This is a handout that I made based on emotional intelligence, and it just has a series of questions. So again, if you are coaching somebody towards better behavior, this is a handout that you could use in your discussion with them. You could give it to them to just think and reflect on perhaps. And this is an activity that you could do with your team. So same kind of idea is, how do we get our team to outwardly self-reflect and share so that others can hear themselves talk but can hear others talk as well, and the efforts that they may be making to improve. All of this is in the idea of preventing conflict. So this is probably my third favorite best practice in here in this presentation, is team values and the development of team values. So I've used this with healthy teams. I've used this with struggling teams, long-term teams, brand new teams. It's the activity of really deciding as a team, what are our values with one another? And of course, they're going to fall in line with the values that you have with your healthcare systems or the companies where you are. But this is a little different. This is more about the group of 5 or 10 or 30 people coming together and thinking about what's important to us as a team. You can also do it with teams that are not necessarily intact, that are sort of constantly moving, by including discussion of team values in a variety of different meetings. The idea here is that you're encouraging a team or a group to think about what's important to us in terms of our treatment of each other, in terms of our mission, however you want to gear it. But you're asking those questions. Sometimes you may be prompting questions if you know the team is struggling with negativity or, blame or gossip or whatever it may be. You may be prompting some to sort of ask, how do we want to treat one another on these particular factors? But the idea is that you end up with 3 to 5 sentences that were created by the team in terms of how they want to treat one another. And there are many different activities that you can do afterwards. You can then use those values to round on employees, kind of how are we doing with this first value that you guys came up with, or the 5th one. Keeps them in front of employees, keeps them thinking about what those agreements were. Sharing key themes in meetings, you can post them in break rooms, I've seen that. You can put it on the back of the agenda items if you print anything, or just put it with your electronic agenda items so that people are seeing it and being reminded of of the importance of those values that were created by the team. So it's one of my other absolute favorites that I use quite regularly. Another intervention is education. So we do lots and lots of small classes. I almost don't want to call them classes. I would really call them topics, where a group may have really struggled with stress and maybe really struggled with conflict. And so as a part of their intervention over a 3 to 6 month period, I may go out and do a stress management class, a conflict management class, and return 6 months after that to do some kind of follow-up on that. So I think education definitely has a place. I don't think it stands alone. I think it's an intervention as part of a customized plan and discussion with a group that needs a particular topic and discussion around that. So team appreciation, again, this goes back to how do we encourage our teams to show appreciation. One of my favorite activities is sort of pointing one person out at a time and having everybody sort of call out what is wonderful about a particular person. That's my absolute favorite. I use that quite often, actually. Thank you cards and certainly appreciation posters where people can write something nice about whoever that is. So lots of other ideas here. Would really encourage you to take a look at the longer list here. These are very self-explanatory. Just wanted you to have the longer list. And here's how you could encourage one person to be more supportive of their team. Again, back to that coaching and helping teams to really think about what they can do. And so the final section is around disrupted teams, as I would call them. And this list of bullet points here is sort of some examples of what I would call a disrupted team, where an event happens or there's chronic conflict or dynamics that are difficult or role clarity issues or people are negative, those kinds of issues that come up in any human group, really. But I wanted to provide kind of what are some of those next steps. And as we started today, really the first step, of course, is to write the problem list, get the story, ask the right questions, and then start to think about what those next steps would be. One preventive measure that I would absolutely put in place as a prevention of disrupted teams and conflict is to really have your teams develop a value around how conflict would be managed. And often I encourage and try to prompt something that looks like this, that of course we'll make every effort to speak with each other directly. If that's not possible, we can speak with our leader. They may help us coach us along, and if that's not going to work, then we can go back to the leader. And we just have to remember that the leader probably will call that other person in. And if we get called in, we just need to remember that it's not that we're getting called in because we got in trouble. It's because our leader wanted to give us a voice. So from your end, as a leader, you can actually share your philosophy and perspective for how you manage conflict. And it may not be exactly like I have it here, but what I have found is that when employees are not sure how conflict is managed, it usually gets managed badly. So you're going to have those really good employees who are just never going to come to you because they don't want to come across as negative, and yet they may be dealing with a very difficult employee. And so then you'll have other employees will come to you all the time but never really want to do anything about it. So to prevent all of that, you want to have sort of a protocol or a ground, almost a value of your own that says, yes, come to me with your conflict anytime. I am open for that. I want to help. Just know that I'm probably going to try to coach you to do something on your own. If it doesn't work, please come to me. But if it doesn't work out, we need to do something. So I'm going to pull that other person in. So I'm saying really the same things that I said in the slide previous, that the team, you want to help your team create, but this is also what you're doing. This way, nobody has to feel like they're talked about, because if they're being talked about, they know that they're going to get pulled in. It also prevents anybody from thinking, oh, I'm just going to go vent and talk about this, but not be a part of any solution. So I hope that's helpful for you. I think it's been helpful for many of our leaders. So for those leaders who are working with perhaps two employees that are struggling with one another or struggling with conflict or trying to debrief an event, this is a simple worksheet. It looks the same as the one you saw before, but this is the EQ model but focused on conflict management. So this is a handout that you could either use in discussion with them, again, or you could actually give it to them in advance of meeting with them so that they come prepared with some self-reflection and some thoughts about the other person as well. So Crucial Conversations is, I put this in here. It's not an advertisement necessarily for the book, but I did want to share that if you have someone who's looking for some more information on conflict management in healthcare, it's a helpful book, and I've had several groups read it and then discuss it afterwards. There's also kind of a summary form of it online as well, so you didn't have to read necessarily the whole book, but I did find that very helpful as well. So facilitating a conflict conversation, interview those who are involved, ask employees perhaps to complete that worksheet, review it with them, meet with them. The one piece of advice I would always give as you are working with people in conflict is to set the next meeting while you're still with them, because otherwise you're going to kind of go back onto the floor, back into the unit and work with one another, and it may be a little bit awkward. And if you throw them back out in the ocean with no set meeting to prepare for, to know that's out there, they may feel a little bit more uncomfortable. So set that next meeting up when you're with them. So in summary, with our case study, so we looked at our problem list: lack of leadership on site, employee stress, communication issues, conflict, and role clarity. Those are some of the tools. The tools in this tools column really come directly from everything that I just said, many of them that you'll be aware of. What I'm hoping is that you got just sort of the key takeaway to get that story and get those complexities as organized as you possibly can, and then start to ask the right questions and get a little deeper, and then you're going to pick your tools and your strategies to match that in a more organized way. I do find that it also is very helpful to sort of track, what are we doing? What's next? Are we having an education person come in? Are we starting a template for SBAR? Do we need to have two people meet together for a conflict session? And again, just that organization to take care of your team. And in closing, there was somebody who sent an incredibly powerful email to a university. It was the president. And I pulled these 5 words from that email. They hadn't listed these 5 words, but they used these 5 words to give inspiration and hope to the faculty. And the words are creativity. How do we continue to be creative in how we think and how we think about ourselves as leaders managing through a difficult time? How do we feel hope ourselves and give it? How do we manage perseverance with agility? So how do we continue to verge forward but be agile at the same time? And then certainly, how do we be graceful towards ourselves for having bad days and being tired and maybe not seeming like we feel like we're perfect leaders at times? And then how do we give grace to other people as well? And so that is my closing for today. I'm thinking about all of you. I know these are difficult times. I know your teams are probably under stress as well. And what I hear from leaders is that it is so difficult to carry so much, to carry their own level of stress, and then to also be the inspiration and the light and the strength for their team. So my hope is that you got a way to be organized and some tips and tools maybe you hadn't thought of before, and that it is a way to reduce your stress as well. And so that is my closing thought. Glad to hear from you now or in the future. This is my passion, and would love to hear from any of you at any time. So thank you so much for having me today. I really appreciate it.
Sanne, that was great. Thank you so much. Wonderful presentation, and I hope you could see not just the thank yous right now, but throughout the presentation in the chat, people were giving you a lot of kudos and saying how great something was that you just said. So just a couple of thoughts here with a couple of our minutes. So I really liked, at one point you said that you prescribe briefs to, a certain clinical team, and I love the language you use there, and I want to use that and encourage people to use that in the future. the question that comes out of that is somebody, right after you said that, said that, they've tried to do, morning briefs and things like that, but most of the time the staff is already busy doing work and doesn't want to leave their patients. I've heard the same thing where people have said, gosh, I'd love to debrief. It seems like such a useful tool to do, but by the end of the day, everybody's left the clinic or everybody needs to go because they have to pick their kid up from soccer practice or they have to move to some other job. So how do you go about encouraging people and getting them to do these things that seem to add time to their day but really will help them be more resilient and will actually help them do work better?
So that's a wonderful question, and certainly we face the same, and so I have as well. So I would say a couple of things. One is have the debrief or the brief anyway, even if one person shows up. Have it anyway. Make it powerful each time. Commit to keeping it short. So that's what I had said with even a brief between just two people. Keep it to 3 minutes, 5 minutes, because it's when it goes over even slightly that people drop it immediately. So 2 pieces of advice. One would be have it no matter what, and then turn it into something that it actually reaches everyone, whether or not that is electronic, it's written on a poster, it's discussed in huddle the next morning, however you can get it to everybody afterwards so that they know this is powerful and this is meaningful. And then again, keep it really short.
That's
a
great.
quick answer.
Yeah, I've heard. Yeah, no, that's a great answer. I've heard people joke before. You want it to be a debrief. You don't want it to be a D-long. D-long would be the opposite.
Well, exactly.
Yeah, right? So what about patients and families? Like how can, I know that this is a strength of how Duke looks at the world, is including patients and families, and you guys are a leader in that. So how have you brought them into some of this, or have you brought them into some of this work?
So I'm so glad you asked. So my philosophy, so I actually, as you saw in my title, is Director of Patient Experience. And so I bring every thought that I use with the team to our patients as well. So a couple of things to answer there is what we do really focus on is the communication with our patients at all levels. Of course, the patient experience from a warm and compassionate way, but also in the clarity of the communication, because that is a safety issue as well. And so in some ways, we almost use these tools in training with our employees and providers for how they communicate with their patients. So an SBAR, for instance, is a perfect communication tool for patients. And then using other tools that encourage patients to be organized prior to actually seeing the provider. So, encouraging them to write out their top 3 concerns before they actually see the provider. So those communication tools that we think of as TeamSTEPPS and with teams are also ones that in a sort of a tweaked, customized way we think about with our patients as well.
I love that. Yeah, getting them in, making them just as important as a team member as everybody else. That is phenomenal. Good deal. So I want to spend, before we say goodbye, I'm going to see if I can navigate here and give our sponsor a quick chance to say hello. And let's see if I can get the slide up. We were talking a lot today about the flexibility needed, right? And the things that you can't control, and sometimes there's tech issues. So I'd like to spend a moment here and say hello to Lynn Gallagher Ford and thank her and the Ohio State University College of Nursing for having the ability and the desire to sponsor this webinar. So, Lynn, are you on?
I am. Can you hear me?
Yes, I can.
Oh, wonderful. Thank you so much. I appreciate everybody hanging in there for another couple minutes for me. so great. The webinar was wonderful, and I just wanted to say thank you for all that great information. And so my name is Lynn Gallagher Ford, and I'm the Chief Operating Officer at the Helene Fold Health Trust National Institute for Evidence-Based Practice in Nursing and Healthcare at The Ohio State University College of Nursing. And the connection is so terrific. You know, the webinar today was about well-being and job support and satisfaction of clinicians and how teams can implement plans to battle burnout and thrive in times of chaos. And it's the stuff that we talk about with the organizations we work with, bringing evidence-based practice to organizations. We talk about this stuff all the time because these are the hot issues. And how an evidence-based approach connects to that is so perfect, because what we heard today was a lot of evidence-based information brought to us by an amazing expert, and that's what evidence-based practice is. What's the right thing to do, and how do you do it right? So when you're interested in doing the right thing for patients and families and meeting the quadruple aim and being an HRO, that's where evidence-based practice comes in, utilizing an evidence-based approach to find out what is the right thing to do and aligning it with your process improvement, how to do the right thing right. That's how we get to the best outcomes. So you can't fix a practice problem with process improvement, and you can't fix a process with practice improvements. You must do both. And that's sort of our message is, how do you know what the right thing to do is, and how do you do it right every time to get patients and families and clinicians, particularly these days, what they need. So that's the work of the Fold here at Ohio State and the College of Nursing. And so if you could just switch to the next slide, I can show folks how to find us on fold.nursing.osu.edu. There's also a QR code here that you can, have access to, like lots and lots of things that we offer at the Fold, webinars and immersions and modular programs. Everything we do historically, where we would go and visit with you, we do online now. We're doing everything virtually. So our 5-day immersions, we have an EVP certificate, we have just tons and tons of resources for people. So as you're struggling or thriving in these really challenging times, I would just encourage you to tap into resources that are out there, and if we can be a resource for you in improving how you use evidence to inform the care and the work that you do, take a look. And it was our pleasure to support this webinar today.
Lynn, thank you so much for that. And yes, thank you so much for supporting the webinar. It was really wonderful to have that, and I'm glad we got to get you in there to say something at the end. Thanks to everybody who joined. Please complete the form that will be sent in your email shortly. You'll receive these slides, and you'll receive a recording. You can download the slides. So if you're interested in any of the things that Sanne said, you could check them out. If you're interested in what you just learned about the evidence-based practice at the Ohio State University School of Nursing Fold Center, then please, go back to that slide and grab the information there. Make sure you do your continuing education stuff. The code is on the screen so that you can get your CE credit. So that's really important too. And please stay in touch. Thank you all for joining today. It was lovely to see a lot of names that we often see, like Dan and Betsy and Beverly. So lovely to see everybody virtually here, and appreciate everybody's time. Have a good rest of your Wednesday.
Thank you, ladies and gentlemen. This concludes today's presentation. You may now disconnect.